They say you never get a second chance to make a first impression unless you're in a hospital waiting room, where every second feels like an eternity, and every glance can carry 1,000 unspoken judgments. When the nurse slammed her clipboard on the counter and shouted at him to stop loitering in the waiting area, Dr. Marcus Ellis wondered if the irony of the situation was enough to make him laugh or cry. Marcus had just arrived at City General Hospital to check on a community health initiative he was spearheading. Instead, he found himself trapped in a nightmare of racial prejudice, a nightmare he had spent his entire life fighting to dismantle. The hospital waiting room was crowded, fluorescent lights buzzing overhead, casting a sterile pallor over the anxious faces around him. Marcus sat quietly, his posture straight, eyes scanning a pamphlet about the new vaccination campaign. His tailored navy suit and the small, discreet pin on his lapel marked him as someone important, but no one seemed to notice or care. A young nurse, her blonde hair pulled back into a tight ponytail, strode over with an expression of thinly veiled impatience. She barely glanced at Marcus before snapping. "Sir, you can't just sit here all day. This area is for patients only. Please move along." Marcus blinked, the calm in his chest tightening into a knot. "I'm here for the community health meeting," he said quietly, his voice steady despite the sting. "I'm Dr. Ellis, head of the city's health department." The nurse's eyes widened in shock, and the entire waiting room seemed to fall silent. Whispers rippled through the crowd like an invisible wave. The woman who had just berated him suddenly looked small and foolish. But Marcus didn't want to humiliate her. Instead, he smiled gently, folding his hands on his lap. "This," he said, gesturing to the room filled with people, "is exactly why I'm here." Marcus's journey to this moment hadn't been easy. Born and raised in the heart of the city's most neglected neighborhoods, Marcus had witnessed firsthand how systemic racism and neglect could devastate entire communities. His mother was a nurse, his father, a factory worker who lost his job when the plant closed down. From a young age, Marcus understood that health disparities were about more than biology, they were about justice. He had worked tirelessly to climb the ranks, earning scholarships, battling stereotypes, and pushing through the doors of institutions that weren't always welcoming. Today, he was the man responsible for protecting the health of a city of over 1 million people. Yet, here in this hospital waiting room, all that seemed to vanish in an instant. The nurse, named Emily, was no villain in the story. She was a young woman overwhelmed by stress and understaffing, raised in a community where biases were often unconscious but deeply ingrained. Her outburst wasn't personal, it was the echo of a society still struggling with its own demons. When Marcus met her eyes, he saw the flicker of guilt and confusion. He took a breath, deciding not to dwell on her mistake, but to use it as a teaching moment. "Emily," he said softly, "we all carry biases, whether we realize it or not. But it's moments like these, moments of confrontation and recognition, that give us a chance to change. For me, this room isn't just a waiting area. It's a symbol of who we serve, and sometimes, it's a mirror of what we need to fix." The tension in the room eased slightly as Emily nodded, swallowing her embarrassment. Some of the patients around them began to smile, encouraged by Marcus's grace. Marcus stood up, extending his hand. "Let's work together. For the city, for the people." Emily took his hand, and in that handshake was the promise of change, slow, difficult, but possible. Marcus released Emily's hand and returned to his seat, but the atmosphere in the waiting room had undeniably shifted. The murmur of whispers had grown into a quiet hum of conversations, many laced with curiosity, others tinged with relief. The faces that had earlier glanced at him with suspicion now looked on with newfound respect. Yet, beneath the surface, Marcus knew that one moment of acknowledgement wasn't enough to erase years of mistrust and systemic neglect. Emily approached him hesitantly. "Dr. Ellis, I'm sorry. I didn't know who you were. I wasn't thinking clearly." Marcus smiled gently. "I understand, Emily. Stress makes us all act in ways we regret. But what matters is how we move forward from here." She nodded, eyes brightening with a mix of remorse and hope. "I want to help. I really do." That simple admission felt like the first step in a long journey, a journey that Marcus had been on his entire life. As the waiting room slowly emptied, Marcus finally stood and made his way toward the conference room where the community health meeting was to take place. Along the way, his mind drifted back to the early days of his career, to the countless battles fought in dimly lit offices and council chambers. One memory came sharply into focus: a meeting 5 years ago when Marcus first proposed the vaccination outreach program for underserved neighborhoods. His proposal had been met with skepticism, even outright hostility, by some city officials who dismissed the needs of minority communities as a low priority. Why allocate resources here when these areas don't contribute much economically? One councilman had said bluntly. Marcus had held his ground, his voice steady but passionate. Health is the foundation of opportunity. When we neglect our most vulnerable, the entire city suffers. It's a matter of justice. That meeting had been a turning point. Slowly, allies emerged, funding was secured, and the initiative began to take shape. Yet, the road ahead remained fraught with challenges. The community health meeting was a modest affair, held in a cramped conference room lined with folding chairs. Marcus scanned the room, noting the mix of faces: activists, local healthcare workers, city officials, and residents from the neighborhoods most affected by health disparities. He took his seat at the head of the table, cleared his throat, and began. Thank you all for coming. Today, we stand at a crossroads. Our city faces a health crisis, one rooted not in biology alone, but in the systemic inequalities that have long been ignored. He paused, letting the weight of his words settle. We cannot address health without addressing racism. It permeates every aspect of our system's: access, treatment, funding. This meeting isn't just about vaccines or clinics. It's about justice. A woman in the front row raised her hand. She was middle-aged, wearing a worn coat, eyes sharp with determination. I'm Linda, she said. I run a community center in East Side. We've seen families torn apart by preventable illnesses because they don't trust the hospitals. How do you plan to rebuild that trust? Marcus leaned forward, appreciating her directness. It starts with listening. We need to partner with community leaders like you, create programs that respect cultural contexts, and ensure transparency in every step. No more top-down decisions made without input from those most affected. He saw nods around the room, but also guarded skepticism. Later, as the meeting wrapped up, Marcus stepped outside into the cool evening air. The city skyline glittered in the distance, a mix of gleaming towers and shadowed neighborhoods. He pulled out his phone and dialed a number. Hey, Mom. I'm done for the day. A warm voice answered. How did it go? Marcus hesitated, then smiled. Better than I expected. There's still a long way to go, but maybe, just maybe, change is possible. Your father would be proud, she said softly. Marcus's heart clenched. His father had passed away years ago, worn down by the stress of poverty and racial discrimination. That memory fueled his resolve. Back at his office, Marcus sifted through reports and emails. One message caught his eye: a complaint filed by Emily, the nurse from earlier, admitting her mistake and asking for guidance on racial sensitivity training. Marcus smiled. This was progress. He drafted a response, proposing a citywide training program designed to confront unconscious bias in healthcare professionals. Days turned into weeks, and Marcus's initiative gained momentum. Partnerships with local nonprofits grew stronger, funding increased, and media coverage brought attention to the disparities he sought to eliminate. But not everyone was pleased. One evening, as Marcus left City Hall, a group of protesters gathered outside, holding signs that read "Stop playing the race card" and "City funds for the people, not politics." A man stepped forward, his voice harsh. You're just a puppet of the system, Ellis. You're wasting taxpayers' money on handouts instead of real solutions. Marcus met the man's gaze calmly. Justice isn't a handout. It's a right. And real solutions come from addressing root causes, not ignoring them. The crowd jeered, but Marcus's words hung in the air, firm and unyielding. At home that night, Marcus sat with his teenage daughter, Jasmine. She looked up at him, eyes bright. Dad, why do people hate you for trying to help? Marcus sighed, pulling her close. Because change is scary. But we have to keep fighting, even when it's hard. That's how the world gets better. Jasmine nodded, determination shining in her gaze. I want to help too. Marcus smiled, hope swelling in his chest. Weeks later, Emily returned to City General, this time with a new purpose. She organized workshops, encouraging staff to share experiences and confront biases. The change was slow, but visible smiles replaced scowls. Understanding grew. One afternoon, She found Marcus in the break room. "Thank you," she said simply. Marcus shook his head. "Thank you for having the courage to change." The story reached its climax when a new health crisis emerged, a contagious disease threatening to overwhelm the city's hospitals. Marcus's programs were put to the test. He coordinated emergency response teams, ensured resources were distributed equitably, and communicated transparently with the public. In the face of fear and uncertainty, the community rallied together. The crisis passed, leaving scars but also hope. At a city council meeting, Marcus addressed the chamber. "This pandemic revealed our strengths and our weaknesses. It showed us that health equity isn't optional, it's essential. We must continue to fight against the forces of discrimination that threaten the well-being of our neighbors." Applause filled the room. Months later, Marcus walked into the same waiting room where his ordeal had begun. This time, he was greeted with nods and smiles, a symbol of progress. Emily approached him with a bouquet of flowers. "For you," she said, "for showing us the way." Marcus accepted the gift with gratitude. The hospital waiting room was no longer the same place for Marcus Ellis. What had once been a space of frustration and judgment now felt charged with possibility. Yet, he knew that a single moment of recognition, the nurse's apology, and the whispers of respect was only a flicker in the long, dark tunnel of systemic racism. As days passed, Marcus devoted himself even more fervently to his work. Every meeting, every phone call, every site visit was another chance to break down barriers and bridge divides. But the battle was far from over. One morning, Marcus sat at his desk in the city health department, reviewing community health reports, when his phone rang. It was Dr. Sandra Patel, his trusted colleague and longtime ally. "Marcus, we have a situation," she said, her voice edged with concern. "There's been an outbreak in one of the city's poorest neighborhoods, Lakeside. The numbers are climbing fast." Marcus felt a familiar knot tighten in his stomach. Lakeside was one of the communities most neglected by healthcare infrastructure. Many residents lacked insurance or access to primary care. The outbreak threatened to spiral out of control. "I'm on my way," Marcus said firmly, grabbing his coat. At the Lakeside Community Center, a flood of anxious faces awaited him. Parents clutched their children, elders leaned on canes, and volunteers hustled to manage the chaos. Marcus moved through the crowd, offering calm words and reassurance. His presence alone was a beacon of hope to many who had long felt forgotten. "We're going to get through this," he told them, his voice carrying the weight of decades of experience and determination. "But we need your trust. We need to work together." That afternoon, Marcus met with community leaders, activists, and local healthcare workers. The room was filled with a charged energy, fear mixed with defiance. One activist, a young man named Jamal, spoke passionately. "We've been ignored for years. Promises made, promises broken. How do we know this time is different?" Marcus nodded solemnly. "I don't expect blind faith. I expect partnership. We're deploying mobile clinics, free testing, and education programs. But I need your voices in this fight." The room slowly shifted, the skepticism easing as plans took shape. Meanwhile, Emily was hard at work back at City General Hospital. She had become an outspoken advocate for racial sensitivity training and cultural competence among staff. One day, during a training session she led, Emily shared her own story, the moment she had yelled at Marcus and the lessons she learned. "I was ignorant," she confessed to the room filled with nurses and doctors. "But I'm committed to change. We all have to be." Her honesty struck a chord, and the session ended with heartfelt conversations and renewed commitments. Back in Lakeside, the outbreak worsened. Marcus coordinated with emergency response teams, pushing for resources, testing sites, and vaccine distribution. But bureaucracy and politics reared their ugly heads. Funding was delayed, supplies misallocated, and resistance from some city officials threatened to derail the efforts. Frustration mounted, but Marcus refused to give up. One evening, exhausted but resolute, Marcus met with Linda, the community center director from the earlier meeting. "Linda, we're hitting roadblocks at every turn. How do we keep the community's faith when the system itself seems against us?" Linda looked at him with fierce determination. "We tell the truth. We stay visible. We hold them accountable." Marcus nodded. "Then that's what we'll do." The media began to catch wind of the outbreak and the struggles within the health department. Local news stations aired stories highlighting the disparities in healthcare access and the courageous work of Marcus's team. Public pressure mounted, forcing city leaders to act. Marcus appeared on a live television interview. When health crises expose deep inequalities, we have two choices, he said directly into the camera. Ignore them or confront them. I'm committed to confronting them. His words resonated with viewers across the city. The turning point came when Marcus received a call from the mayor's office. We're allocating emergency funds for Lakeside, the aide said. We want to support your efforts. Marcus allowed himself a brief moment of relief. The fight was far from over, but this was a victory. At a press conference announcing the new funding, Marcus stood at the podium, flanked by community leaders, healthcare workers, and Emily. Today, he said, voice steady, we take a step toward justice. Not just in Lakeside, but across our city. Yet, the path to change was marked by difficult conversations. Marcus convened a roundtable discussion with city officials and community advocates. Some officials resisted the idea that systemic racism played a role in health disparities. It's not about race, one argued. It's about economics. Marcus responded, economic inequality is often the result of racial discrimination. We cannot solve one without addressing the other. The debate was heated, but necessary. At home, Marcus's daughter Jasmine grew more involved in social justice causes, inspired by her father's work. One evening, she asked, Dad, do you think people will ever truly change? Marcus smiled, pulling her close. Change is slow, but every voice matters. We have to keep pushing. Emily's transformation became a beacon for others in the hospital. Her advocacy led to policy changes that improved patient care and staff training. One day, a patient approached her, tears in their eyes. Thank you, they said. You made me feel seen. Emily realized that small acts of kindness could ripple into larger waves of change. Meanwhile, the Lakeside outbreak was finally brought under control. Marcus visited the community center, greeted by cheers and hugs. This victory belongs to all of us, he said, overwhelmed with emotion. But the story was far from over. Marcus knew the real work was ongoing, dismantling the roots of racism in healthcare and society. He prepared for a citywide initiative focused on education, outreach, and policy reform. The final scene unfolds at a city gala honoring Marcus and his team. As he accepted the award, Marcus spoke from the heart. This isn't just about me. It's about every person who has ever faced discrimination, who has ever been denied care, who has ever been told they don't matter. Our fight for health equity is a fight for human dignity. The audience rose in a standing ovation. The story closes with Marcus walking through the now-transformed hospital waiting room, a place once filled with tension, now a symbol of hope. Emily caught his eye and smiled. Together, they stepped forward, ready to face the future. Marcus stood in the hospital lobby, the familiar buzz of fluorescent lights overhead blending with the quiet hum of progress. It had been a long, grueling journey marked by setbacks, confrontations, and moments that tested his resolve, but today, the waiting room no longer felt like a battleground. It was a place of healing and hope. As he walked past, Emily approached him, a calm smile on her face. Dr. Ellis, there's someone here to see you. Curious, Marcus followed her to a side room where an elderly black man waited, his eyes sharp, his posture proud. Mr. Carter, Marcus greeted him warmly. It's good to see you. Mr. Carter nodded. Likewise, doctor. I wanted to thank you personally. Your work saved my granddaughter during the outbreak. Marcus felt a lump in his throat. This was why he fought. The city had changed. Not overnight, and not without struggle, but the cracks in the system had begun to close. Health outcomes in marginalized neighborhoods improved. Trust was being rebuilt. The barriers of bias and neglect slowly dismantled. Yet Marcus knew complacency was the enemy. He remained vigilant, pushing for continuous reform. One afternoon, Marcus found himself in a community school, speaking to a room full of teenagers. His daughter Jasmine sat among them, beaming with pride. He spoke about resilience, justice, and the power of community. When you stand up against injustice, you carry a legacy, he told them. But more importantly, you shape a future. A hand went up. What keeps you going, Dr. Ellis? He smiled. Hope, and the belief that change is possible when we refuse to give up. Back at the health department, Marcus's phone rang. It was Emily. We're launching a new cultural competence program next month, she said enthusiastically. It's the first citywide initiative of its kind. That's incredible, Marcus replied. Thank you for leading the charge. We're all learning, Emily said. Together, the city's mayor called Marcus into her office. Your leadership has transformed public health, she said sincerely. We want to expand your program statewide. Marcus accepted the challenge with humility. The fight for equity stretched beyond city limits. At home, Jasmine presented Marcus with a school projector mural depicting diverse faces united under the banner, Health Justice for All. Tears welled in Marcus's eyes. You're the reason I keep going, he whispered. Months later, Marcus stood at the podium during the city's annual health summit. The room was packed with healthcare professionals, activists, officials, and residents. He spoke candidly about the journey, the obstacles, the pain, and the victories. Our city is stronger because we confronted our darkest truths, he said. But our work is never done. We owe it to every person to build a system rooted in dignity, respect, and equality. The audience erupted in applause, standing in unity. As the event concluded, Marcus stepped outside into the warm evening air. The city skyline shimmered, alive with possibility. His phone buzzed a message from Emily. Thank you for showing us the way. Marcus smiled, looking up at the stars. The story closed on a quiet moment. Marcus sitting by his office window, gazing out at the city he loved. He whispered a vow to the night, to justice, to hope, to a future where no one is judged by the color of their skin, but by the content of their character. And with that, Marcus Ellis turned back to his work undaunted, unwavering, unstoppable. Thank you for listening. If you find it interesting, please like and subscribe to follow the next stories.